Hello and welcome. And today, Mary Jordan is going to be joining us to talk about dodging dementia. She has a new version of a book that she had previously released, and this is more up-to-date information. And what I would like to say, Mary, is I just thought it was an excellent book. I mean, it is so well researched. And what I really liked was how many clinical studies that you went to look for your information. But having said that, that makes it sound very dry. And I don't think it is a dry book at all. I think it's something that actually is a really practical guide to actually help us try to dodge. And I think we'll probably talk about the word dodge in a minute, about dementia. And if, you might be slightly concerned, like I was, I mentioned to Mary that before I read her book, I was slightly concerned, having had, in fact, my mother had vascular dementia. And so I think that if you are, have a close relative who has dementia, I think it can sort of worry you. And I just want to say this book is it's actually far from worrying. It makes you really think about what you can practically do to mitigate the risks. And once again, I think we'll discuss the risks. We're talking about lessening the risks of getting dementia. And so what Mary does in this book is to look at what are the most significant risk factors that we know are associated with dementia, and what is in our capability to lower those risks. So welcome, Mary.
Thank you. Hello. And you're quite right. I wrote it as a practical help, self-help almost book.
So Mary, would you like to give us a little bit of background because obviously you work with people that either have dementia or are carers.
Yeah. Yes, I do. I've worked in dementia for about 17 years now. Quite a few of those years, about 9 or 10, were with Alzheimer's Society, which was very good because I got a huge background there, plus all their training. And the benefit when I worked for Alzheimer's Society was the range of people that you saw, because it's a completely free service. So I saw people across the board. So you saw worried people, you saw people who were caring for people with dementia and people who had dementia. So that was a really, really valuable background. But I've also got a personal background because I looked after my mother-in-law who had what you've just described as vascular dementia. And that's what got me interested in the first place. So it's a bit of both.
Yeah. So I know that your book, and I think you wanted to make sure for clarity. So we're really looking at the main 3 types of dementia, which are Alzheimer's, vascular, and Lewy bodies. And it's to say that you're not a clinician as such, and most of this is either the stuff that is quoted in your book is either from as I mentioned earlier, the excellent research you've done, along with very much your practical
personal
experience of working with people with dementia.
Yes, absolutely. So I've tried to put the two together there. And I have identified in the book where it is, this is my experience.
Yes. So. And I understand that why you probably feel that you have to be very careful with that, because everybody is looking for that. Dementia really is like the last bastion of, where is the breakthrough, because there aren't those breakthroughs. And I think through your book, it's very clear that there's so many clinical trials that look so hopeful at the beginning, to be damned a bit later. So everybody is looking for that golden cure. And we know at Talkhouse we don't like the word cure, that it is very difficult to write about this.
Everyone, we're all used now to virtually everything being curable, if you like, or manageable. So you might say diabetes is not curable, but it's manageable. And we're all looking for that. We're looking for the magic pill. And my personal feeling about dementia is that there is no magic pill, because I think it's a multi-factor illness.
Yes, and I think it depends on a person's life or journey through life and what they encounter. And I
Yeah.
think it would be good if we go through those major things, you know, from the social to the trauma to the diet, all of those things that you say as being
Yeah.
things to look at.
Yeah. Although there are so many factors, we might just have to deal with one or two.
But should we look at, you know, some of the main ones then?
Yes, by all means. So I would pick, I mean, my biggest change, the biggest change that I've said that people can make, and the simplest change, is in diet. I don't think any of the fancy diets necessarily are magic, but reducing as much as possible sugar in the diet would be make a dramatic difference, I think. And it's the easiest one to do. It's not easy because we all love a bit of sugar, but I mean, it's the simplest one to do. You know, it doesn't involve any weird blenders and smoothies and everything else. It just involves you reducing the amount of sugar you eat. So I
And
would say that's a really simple thing you could do.
yes, and I think I mean, the good news is there is so much now around about processed foods, and the
Yeah,
fact the processed
yeah,
foods have such a high content
yeah,
of sugar and all of the other things in them. And
yeah.
I think what was useful in your book was very much looking at that diet, and you went into great length about carbohydrates and low fat, high fat, and all of those sorts of things. But it is the sugar and the fact the sugar in just the sugary drinks.
Yeah, but the sugar in nearly everything, it's really frightening. I was staggered when I looked at things. Gravy granules, the sugar in them. Why would you think that? You know, it's things like that. If you read the labels, it's quite horrifying, the amount of sugar that's in everything.
Yeah, and bread, as you mentioned.
Yeah, yeah. And virtually any canned food, and low fat food is usually much higher in sugar, which is another frightening thought because people often tend to automatically go for lower fat, thinking that that's healthy.
And does that then lead on to the fact that which struck me very much was that type 2 diabetes is one of the most seems to be one of the most researched and one of the most considered
Yeah,
largest risk factor
yeah,
for
very
dementia.
high risk factor. There's one or two um, scientists and doctors who claim that Alzheimer's disease actually type 3 diabetes, which is interesting. So it's a very high risk factor, type 2 diabetes, which might well connect up with the sugar.
Mm. And then I think when you were mentioning about diabetes, you then went on to the thyroid. There's people that have hypothyroid also appeared to have in clinical trials a higher percentage of having dementia.
Yeah, there seems to be evidence to that effect, yes. It's quite difficult in the UK because thyroid is a very fuzzy area. You'll find that it's treated differently in different countries. So it's a difficult one to pin down, but yes, that is another risk factor. Not as high as diabetes, though.
No. So diabetes, stroke diet, stroke sugar would
Yeah.
be one of your major risk factors and something to look at and to consider.
Yes, diabetes and sugar. As I say, I'd like to make the point that we shouldn't need to go into any strange diets, you know, any exotic diets. I think what we used to call a good mixed diet is probably fine, but reduce the sugar.
And it was interesting then sort of thinking about the supplements when you talk about taking supplements and,
Mm,
you know, be this and be that,
mm,
is once again, I think very much again that although some research says that these work, then
yeah, yeah,
counterbalance saying, well, no, because then actually that can cause early death. So
yeah.
do you want
That was
dementia early?
frightening, wasn't it?
Yes.
Mm,
Very, very surprising.
mm. I think there are vitamins and vitamins. There are supplements and supplements. Vitamin D is a supplement that's really come to the fore now, because in this country we don't get enough because we don't have enough sunshine. Looking out my window at the moment. So I think that's come to the fore, and the knowledge that we can take much higher supplements of vitamin D than was previously thought to be the case. So, that is one particular supplement that's worthwhile. But there's also some evidence that seems to indicate that a supplement isn't as good as what you get from your diet. So again, it's a little bit equivocal.
Yes, and I think sometimes with a lot of vitamins and those things, they're broken down so much that you lose the other benefits that you get from eating the roughage that goes with the actual.
Or eating the whole, yes, the whole factor. A bit like some medical treatments, that came from herbal medicine. And then when they're refined and refined and refined, they don't have all the other factors that seem to benefit people. Yeah.
So after the sugar in the diet, what would the next thing be that you would suggest?
I think exercise is a major factor, partly because exercise is known to be good for us anyway, per se. So you're going to be healthier if you exercise. I wanted to emphasize to people that exercise doesn't mean you've got to sweat it out in a gym. This is often puts people off. It's just doing more. It's just getting up from your chair and being more active. We're meant to be active. The body is meant to move a lot more than it's meant to sit. So even just brisk walking, bit of gardening, we've got these lovely sports for seniors now, walking football and walking netball, which I think must be great fun. I haven't tried them, but I'd quite like to try walking netball, I must say. So that, you never have to stop, however old you are.
And I suppose the two things that come out from that is, one is the increased, because we know a lot of it is around the sort of I was going to say the flow of the blood. Now that's clearly not what any clinician would say, but the increase in your heart rate and your blood pumping through everywhere.
Blood pumping through, blood getting to the brain.
Yes.
Which is, a major factor, really. When you're talking vascular disease, that's a major factor. So yeah, all that. Plus you feel better.
Exactly. And I suppose as well, with exercise comes with, and you've absolutely nailed it on, is the sociability, which we know is another thing that's really important.
Yeah. Yes, I think not enough emphasis is placed on that. And my experience during the COVID years, as they call it, when we were restricted from social intercourse with people, I think made a difference. And certainly I noticed, this is personal again, but I noticed a big increase in inquiries and a big increase in the number of clients I had at the end of the lockdown and following on from that. And a lot of people have said that it had such a bad effect on them. So that's almost like evidence in itself, just to see what happened. It's not good for somebody. It's not good for people to be, not in touch with people.
Be alone.
And one of the other factors that, there was a huge. We're talking online now, and there was a huge increase in online contact, but it's not the same.
No.
And it's certainly not the same for people with incipient dementia. So, people used to say to me, well, can't you I could do advice online, but they used to say, can you run your stimulation groups, memory stimulation groups online? No, you can't. It just doesn't work.
No. And I think also, from my personal experience with dementia, is the brain is so clever at hiding it. So you can have that, if we met on Zoom, you might have, I speak to my elderly patient. We're saying elderly, but obviously dementia can strike at basically any age. But if we're just assuming that the sort of
it's much more common with older people.
Yes. is that, you can have that 5 or 10 minute, well, I've had a 5 or 10 minute Zoom thing. The chances are you're going to go through the same conversation that you would do every time. The brain is clever enough to be able to know what answers to be able to provide to that 5 or 10 minute casual conversation, because you're repeating it.
That's a very good thought. Yeah, yeah. Often people with early dementia can interact socially quite well, and that's why it's often not diagnosed early, because in casual contact, you're quite right, people can carry on, oh hello, yes, and then have a good chat, and it seems perfectly fine. But if you spend an hour with them, you start to realize more what's going on. Yeah, the brain is clever at doing that.
Absolutely. So other things, so we've discussed exercise and diet.
And and social contact.
Yeah. What I mean, I know there's a whole list of them
Yeah,
written down.
I suppose this is more, again, from personal experience. It seemed to me that trauma, mental or physical, it's known that repeated knocks on the head can be a cause of dementia. So that's been known for quite a long time. But I've significantly often met people who've had a major mental trauma or emotional trauma, perhaps we should call it. And I've often wondered how much significance that had on the development of dementia. I don't know, because I'm not a doctor, I can't work out how or why, but just empirically, just seeing people and seeing how often a major trauma has appeared to be, in the recent past. And, did it cause it? Did it make it more likely that it would happen? So I think that trauma is a factor we should all take into consideration. And I did discuss this with the doctor, with Jerry Thompson, who wrote chapter 4, and he said, he agreed with me that you could see that. I'm not sure. Well, the research is fairly limited on that. Some of it's in America with veterans has been done.
Yes, I saw that, and I thought that was really interesting. They were sort of saying that the people that came out from World War II.
Oh, that was interesting. It's World War One.
Oh, was it?
Battle fatigue, yeah.
Yes,
that's where it started. Yes, people who managed not to get shell shock, as it was called then, and now it's some PDST, but they were people who had a stable home life, a stable and I'm trying to think of a nice word for it, a pleasant, stable life, loving home life. They managed to not get shell shock more than people who had a traumatic and difficult childhood. So that's one factor. And I think we could draw conclusions from that.
And I think also that the other example that was given was that people that had very recently had 2 or 3 traumas close together, so their which can obviously happen when you're older.
Yeah.
Your partner dying triggered it to come on very quickly, dementia to come on quickly.
Yeah, that's that. A lot of people have said to me that this is what brought it on. We don't know if that is what brought it on, because the two could be coincidentally, it could just be cause and effect. But yes, I do see a lot of that. A lot of people saying, oh, it happened after this. We noticed it after this. And so, you've got to start asking questions about that.
One of the things, and which we know depression is very closely linked with those with dementia. And I don't think in the book, and forgive me if I'm wrong, there isn't much written about dementia, depression. But I know that's because this is really, we're not talking about people that have got full-blown dementia. We're talking about not getting it as opposed to already having it. But that would sort of lead on to the fact that maybe that sort of feeling is that when you do have depression, you start and then you get older, and I know this is common, people start giving up. They start giving up using their brain because they can't be bothered.
I think that does happen. One of the things I've noticed is people who haven't been allowed to use their brain to make decisions again, this is personal, subjective, this is what I've noticed, but people, I don't want to say women, but it often used to be with the older generation that the man took all the decisions and he did this and he did that. And it's almost as if people have then said, well, all right, if I'm not going to be allowed to use it, I won't bother. But that's, that's supposition, but that's the way it looks. And you have to wonder, if you're not using your brain, does it just give up?
It's easy to be lazy with one's brain.
Yeah,
Talking from personal experience.
Yeah. And the older you get, the easier it is, because you've always got terribly helpful children who will come along and say, "Oh, Mum, you don't know how to use that. Come on,
you're too slow. You're too slow.
Yeah, you can't do it. You never learn."
The one bit that I did like, and it was, and I just thought, for me that's great, is they were talking about brain training. In fact, brain training is not worth the time of day.
Well, it's very difficult, this, because it depends what you call brain training. People think that, clients have said to me, "Oh, my wife can still beat me at Scrabble." Fine. Well, she can beat you at Scrabble because that's almost sort of hardwired into her, because she's been playing Scrabble for years and years and years. So why would she lose that until right towards the end? But it's learning new things. It's doing things differently, and that's what older people find hard to do. And you tend to start going always to the same supermarket because I know where everything is. You might even go to the same petrol station to fill your car up because I know where to go. I always take the same route to buy my paper in the morning. You get these standard things because it's easy. Why wouldn't you? But you need to get out of that. You actually need to be doing things differently. It doesn't have to be learning. It's lovely to learn new things. That is a good idea. But it could just be doing things differently. Why not take a different route?
Well, it's the neural pathways, isn't it? So that's why lots of people with dementia can, they can sing, they can play the piano, because that neural pathway is very strongly embedded in them.
Absolutely, yes. That's shown. A classic one that's always told to us is the London taxi drivers, having to learn the knowledge. And you can see that area of the brain is much more developed. Another one that's classic is violinists. The area of the brain which controls their hands is much more developed because that's what they're having to do all the time. So it's quite revealing. It's quite revealing. And you're right, it's neuroplasticity, as it's called, just making your brain more able to cope with different things.
Yes, and the reason that I'm sort of aware of that is very much because we do quite a bit of people who have MS. And that's one of the things to keep the movement going, is if you feel that you've lost the movement in a particular way, you have to find another way to do it. And that's how that I understand that. And it definitely makes sense to keep your brain alert by trying to do something slightly different.
Yeah. I don't know whether you read this particular, I think I did put it into this book. I put this into a lot of my other books, is that you can liken the brain in a way to, if you go out driving to the local shops and the road's closed, so you have to switch to I'll go down that way. And you go down that way and then there's an accident. And so you've got to switch to another way, and so on and so on. Your brain is doing that all the time. So your brain is, without you knowing it, your brain is working out different routes all the time. And the more plastic you can make your brain, the more you can make your brain able to do that, the better. So that's a really big factor, actually, brain plasticity. But it's almost something you can work on it now, but a lot of that brain plasticity comes in our early years. So there is a lot of evidence that people who have 12 years or more education are less likely to get dementia than people who haven't. And that's really because of developing the brain plasticity. So we're not quite sure how much you can take that into older age or how much it's developed. I would have thought you could still develop it. That's,
And other things that I was sort of interested to hear, and it has been in the press quite a lot, is around hearing loss.
Yes. There's been some very new research on that, quite interesting and dramatic research that's shown that people who have hearing loss are more likely to develop dementia. And it was originally said that that was due to social interaction. You're losing your social interaction if you can't hear properly. There's been more recent research that suggested that it's more due to the fact that while you're concentrating on hearing, you're not concentrating on everything else. So too much of your brain is being used to hear. I don't know, because again, that's in its early stages, that. But it is true that the majority of my clients have some hearing loss. That's age, though. But the ones who won't wear their hearing aids, the ones who usually go downhill faster. So it's not so much the hearing loss, but the correction. Wear your hearing aids.
It's funny, my mother, when we knew she definitely had dementia, but she was still sort of allowed, and she was still allowed out. She went to have her hearing tested, and she just would not have it, even though she was shown the results that she had a hearing issue. She could see it on the charts and all of those things. And so we had bought the most expensive hearing aids for her to use in the hope she would use it. Would she? No.
No, that's a real difficulty, isn't it? I think there's a lot of denial around hearing. Most people just don't want to think that their hearing is bad, so they'll tell you, no, it's just everyone muttering. If they all spoke up, I'd be able to hear. I don't know. I think it's because it makes you old. I think that's why there's a denial about it. Old people are deaf. I think.
Susanna, as in Susanna Constantine, who's Susanna and Trini.
Oh, yeah.
Susanna has come out to say that she has hearing deficiency, probably through from going to concerts and things when she was younger.
Yeah.
And I think it's excellent that somebody like her can come out to show it's socially acceptable. It's not because you're old, it's because you have this problem. And I think it's really...
That's marvellous, isn't it?
Yes.
Yeah, but I think people associate it with age, and that's why they don't want to admit it. That's all I meant. I didn't mean that it is old people. It's just how people associate.
Absolutely. And then the more that we can get people to understand it is socially acceptable, have a hearing, and I'm sure that people of my age, many of their male partners absolutely need to have hearing aids, but will they go? No.
You mean he's not listening to you?
Well, they do obviously have selective hearing, but that's another story.
Actually, there's some interesting research on that.
I was just looking at other things that struck me, because I'm aware that we've been chatting away and the time has just whizzed by. Is there anything else that you feel that we've missed out, which is, once again, what we've been talking about are the risk factors and where we can improve? And in fact, one thing that springs to my mind is about drugs, the drugs that we take on a daily basis.
Yes, I think it's known that some common drugs that are given out, willy-nilly almost, can affect your cognition. That doesn't mean that you will have dementia, but it may mean if you can stop taking that drug, you will be better. Your cognition will be better. So, how many people who've been diagnosed with dementia are under the influence of a drug? And it's something people need to talk about with their doctors, and it's very hard to do because most doctors will say, no, you mustn't stop taking X, Y, Z. And perhaps you shouldn't, but you need to know the risks and benefits.
Yes, and I think the two that came out most were the statins and the proton prohibitors.
Yes.
For reflux.
Yeah, absolutely. Those are two that are highlighted in Dr. Jerry Thompson's chapter, yes, as being something that is given out very commonly to people.
And what I really liked in the book was the mention of, do check yourself every year what pills you're taking. Do you understand why you're taking those pills? Not out of habit. And I thought that was a really important message, because our doctors don't have time to go through your drugs. And, I think we need to take responsibility ourselves. You're absolutely right.
And if you can't find the information for yourself for some reason or another. The pharmacists are very helpful in that respect. Pharmacists will often go through your drugs and talk them through with you. They may have more time than your doctor, so make use of them.
Yes, and when I say that, I'm not expecting that we should understand what those drugs do to our body, but it's just taking responsibility to understand we are taking these drugs and ask somebody who does understand what the, there could be a lot of contraindications sometimes.
And remember, if you're taking a drug and it's affecting a physiological part, which it is, because otherwise you wouldn't be taking it, then it's not in isolation. It's going to have effects on the rest of your body, which maybe you can cope with because of the benefit of the drug. But at least know about them and consider it.
So I obviously just jumped in there and said what I thought we'd missed talking about. Is there anything, Mary, that you feel that you'd like to cover?
I think that something that's come into the fore now, but people tend to dismiss, is the effect of all the electromagnetic things that are going on around us now. We know that they affect the birds and the bees, that's been known. So it must have some effect on people. That doesn't mean that we should give up everything electronic. I'm not trying to suggest that, not that kind, but we can think about whether that's distracting. If too many appliances are on in your home, is it just distracting you so that you can't think straight? You could, I have suggested to people, try switching off the Wi-Fi at night. They go, oh, but I mean, you're not using it at night, are you? But you're being bombarded with it in your sleep. So it's just a thought. It's just a thought. I think we need a lot more research on that.
Well, it's been fascinating chatting to you, and I always say I enjoy when I do read the people's books. I do enjoy them because it's so educational, because it's understanding our body and cause and effect.
Yes, and being responsible for your own body, as you said. I think quite right.
Thank you so much for your time.
Lovely to talk to you.
Thank you.
Okay.